Africa Youth Trust is a youth-led organization working with youth across Africa. Since Kenya was hit with COVID-19, we've realized that COVID-19 has really affected the lives of youths, and as a result of COVID-19, most of the youth that we've interacted with, they have shared their experience, and they say that most of them have been laid out, and as a result of this, some of them have been forced to indulge into criminal activities. So as AYT, what we've been doing to respond to COVID-19, we've been working with young girls from the informal settlement, that is Nairobi and Mombasa. In Mombasa, we are working in the 4 informal settlements: Ziwa la Ng'ombe, Bangladesh, Owinohuru, and Chuda Moroto. In Nairobi, we are working in Mkuru Kwajenga and Majengo. So our main target, we are targeting young urban women in the age of 15 to 29. The reason as to why we chose these 2 cities, because we realized that most organizations, they work with youth or women in the rural setting. So we realized that even the young urban women living in the informal settlement, they are really faced with a lot of challenges. There's the issue of sexual and gender-based violence. There's the issue of teenage pregnancy, drug and substance abuse, and nobody's talking about that. Since Kenya was hit with COVID-19, what we've done with these women living in the informal settlement, we've tried to educate them, to create awareness on women's rights, because we realize that when you look at the prevalence rate when it comes to sexual and gender-based violence, it's very high. And another thing that we are also doing, apart from creating awareness, we have the 21094 SMS platform, whereby women and girls who have experienced sexual and gender-based violence, they can report to our SMS platform by simply sending the word help, and then we'll respond to them. We support them through legal, medical, and psychosocial support. Another intervention that we are doing in managing COVID-19, we are providing dignity kits to these young urban women living in the informal settlement in our areas of coverage. And our dignity kit comprises of 4 sanitary towels, 4 innerwears, and 1 bar soap. We realize that they are faced with economic crisis, and sometimes they cannot even afford the menstrual hygiene pack.
As part of our interventions, we have had several engagements with community members, community leaders, and the health officers within Majengo and Mukuru. We've had capacity building sessions with our champions, the young urban women, who are our mouthpiece in the community, in promoting the information about behavior change and communicating the right strategies to protecting one from contracting COVID-19. Further, we have identified wash facilities, toilets, that are commonly shared by community members that are undergoing renovation in Mukuru and in Majengo. We believe that by building these facilities for the community members, we are going to empower them, because access, we can't talk about hygiene when there is no access to the facility. We've also distributed information and communication materials. These are materials that have ways and means of how one can protect him or herself from contacting coronavirus. Yes, we work with media houses, the Royal Media Services, the Standard Media Group, and the local community stations like the Ruben FM and the Ghetto FM, where we've had sensitization forums to sensitize communities, and our reach with these sensitization forums has come to at least 500,000 people. Our target population, which is the slum residents, highly subscribed to the local channel, so we have reached them with the right information, and we have ensured that no one is left out. We're working in partnership with health officials to provide timely access to basic healthcare services, and we are empowering communities to encourage information and pitch information that support tolerance and support for COVID-19 community members without necessarily victimizing those who are directly affected or affected by the disease.